Good morning, good afternoon, good evening, depending on what time you're watching this presentation. I'm Dr. Quinn, and I want to first congratulate you. I want to welcome you to the Quinn Healthcare Weight Loss Experience. That's right. There is so much success to be had, and you're on your first day on this journey to better health, which you deserve. Now, the medication that we're going to talk about in this presentation is Phentermine. It's also called Adipex, and overwhelmingly, patients have returned for their follow-up appointments and they've reported nothing but success so far. And I am just so excited for everyone that is starting this journey with us to a better state of health. Now, the medication Phentermine, it has two benefits that are very, very helpful as far as reaching a healthier weight. Number one, it decreases your hunger. Number two, it increases your metabolism, resulting in that success that you deserve. Now, you did receive a packet that demonstrates or articulates a lot of the potential side effects. That doesn't mean that you're going to have the side effects, but we still want to give you the information to be on the lookout for so that you can let us know what's going on. But do note, if you're having a medical emergency such as chest pain, shortness of breath, thoughts of hurting yourself or someone else, call 911. And if you're in any doubt that you are having a medical emergency, call 911 because safety is the number one priority. Now, let's talk about how does the medication work? Like, what does it do? Well, the deal is every human being has what's called adaptive mechanisms in their body to keep them alive. An example would be if you're working outside in the sun, your skin becomes darker, more melanin. And the reason for this is it helps to protect you from skin cancer. You don't think about it. I mean, you're working outdoors in the summer, and your body has these hormones, these regulating hormones that just release in your body that go to your brain to cause you to have more melanin under the skin to make your skin darker to better protect you from the extended exposure of the sunlight to help protect you from getting skin cancer. You don't think about it, it just happens. The same mechanisms are in place. For instance, if you go into a room that's very dark, your pupils will dilate so you can see better. This helps you so you can better protect yourself. It goes back to our primitive days when we were in scenarios where we might go into a darker environment and the pupils dilate. It could better protect us from predators. Or if you go into a light room, your pupils constrict. This is your autonomic nervous system. But basically, these survival mechanisms keep you alive. The relevance to all this is an individual that's eating healthy. They're on a diet. They're exercising. They're doing everything right. And they're starting to lose weight. It's going down. It's going down. Those mechanisms go into place. The person that's losing weight, your body is actually working against the process. So what happens is, like, for instance, in your stomach, you start releasing an increased amount of a hormone called ghrelin. And what ghrelin does is it goes to your hypothalamus and it says, get hungry, eat more, eat hard, you're losing weight, we can't do this. Also, your fat cells, they decrease in a hormone called leptin, and this decrease goes to your hypothalamus, I'm hungry, eat more, eat more. But what your body is really trying to do is maintain equilibrium. Because if we go back to those primitive days, and I'm talking about the caveman days, when you start losing weight, back in the primitive days, we didn't have the global thinking that we have now. So what happens is usually there's not enough food. So these hormones would cause these primitive men and women to become more aggressive. Get out there and hunt harder, or maybe move to another area because they're so hungry, and then they would get their weight back up and the body would stay alive. It's a survival mechanism. But the bottom line is in 2000 20 and 21, 22 and 23 and 24, we don't need that anymore, because we when we're trying to lose weight, we're doing it for a different reason, not because there's not enough food, but because we're trying to get healthier. But the body, it doesn't know that. So when the person is losing weight, they start releasing those hormones at different levels, and then they level off. They're not losing weight anymore, and in a lot of cases, they start gaining weight to get back to where they were. It's called metabolic adaptation. But the good news is, when you take the Phentermine that we're going to prescribe to you, it causes your body to block those hormones at the level of the hypothalamus. So when those hormone levels change, you don't become hungrier. Your metabolism does not slow down, but you maintain not being hungry. Your metabolism speeds up some, and you get that success you deserve. It blocks those mechanisms. So individuals that are losing weight, being successful, they come back and report that they started eating healthier and they were able to stick to the diet. That's right. I had a lady just yesterday that told me, Dr. Quinn, every evening when I get off work, I pass by 8 fast food restaurants. And since I've been on the medication, I just look at them and just, all right, see you later. And she drives right past them to her home, where she eats a healthy dinner with her family. She can get rid of that temptation. So that little kid that comes to her desk and maybe they have some candy or donuts or popcorn or whatever, she's like, it's okay, thank you so much. You can resist it because you're not overwhelmingly hungry, and you can maintain the compliance to get the success you need. So I close by saying, welcome, congratulations on the success that you, but not only you, your entire family and everyone loves you, deserve it, and basically decrease hypertension, decrease medications for diabetes. We've had some patients to get off of their medicine, but in conjunction with their primary care physician, if it wasn't me, they were just coming for weight loss. But over time, avoiding that heart attack, avoiding that stroke 10 years from now, and getting that higher quality of life that you deserve. Welcome, congratulations, and I look forward to working with you as we go down this journey together.